Now, false labor gets a bad rap. It sounds like it's all made up in your head, but false labor goes by other names: Braxton Hicks, practice contractions, early labor, and today I want to tell you the difference between false labor and true labor. And yes, I'm speaking to my 20 years in labor and delivery, watching plenty of patients go into labor, and also having 3 babies of my own. And if you're thinking about false versus true labor, you're probably in your 3rd trimester. I actually have a whole 3rd trimester prep pack that I'm going to link to down below. It's going to be so helpful. It has so many goodies in there. Be sure and check it out. Now, here are a few things you need to know about false labor, which again, practice contractions can be early labor. I have a friend who said you never really knew that you were in labor until you're actually in labor. So it's always like a hindsight thing. All of us are thinking, is this labor, as we're feeling different things in our bodies in the 3rd trimester? So all of that is totally normal. But if you ever have any questions, call your provider, or you can go into the labor and delivery unit. The first one is that false labor contractions will go away with hydration. That's right. This little baby here can save you from having those annoying pains. Your uterus, when it gets dehydrated, makes these tiny little contractions that we call irritability. I know you know what irritability feels like because you're pregnant. But when we rehydrate the uterus, it stops making those tiny little contractions. So that's something to think about. Am I well hydrated? Is my uterus getting enough fluids? You know, your uterus will tell you. But if you're feeling contractions, I always recommend to drink 2 giant glasses of water to see if your uterus is just irritable or if it's something more. And remember, if you're always wondering, I can't tell how hydrated or how many glasses of water should I be drinking, check the color of your urine in a white toilet. It should be fairly light yellow. If it is looking to a darker yellow, that is far too dark. You need to be drinking more fluids. Because I gotta tell you, girls here in the Phoenix area during the summer need to drink a whole lot more water than girls in the Midwest during the winter, I would guess. Now, another thing about false labor contractions is that a lot of times they only occur in one area. So you're only going to feel them in your front, you're only going to feel them in your back, and they don't wrap around your whole torso. A lot of times when you extend into real labor, you're going to feel that wrap around your whole torso, and your whole midsection is going to kind of get into the groove of contracting. Now, often false labor is not accompanied by the other signs of labor. And we're going to get a little bit more into that. Stay tuned for more about the signs of labor. But a lot of times false labor comes just on its own, which is different than real labor. And like I've tried to say in this whole video, a lot of times this false labor is actually early labor, and it may turn into something, or it may end up stopping. Now, I'm not exactly sure when this video is going to go out, but I like to use the Olympic theme as part of your labor. In the Olympic theme, they talk about going faster, stronger, higher. And those are the things that will tell you if you're trending toward actual labor. Faster, meaning the contractions are getting closer together instead of further apart. Stronger, meaning they are more painful. And usually, you know, when we get into active labor, that's something that you really cannot talk between. And higher would really just be, you know, is it involving your whole body? Are you having other symptoms beyond just a contraction every now and then? So when you're trying to decide if it's false labor or true labor, remember, faster, stronger, higher. We're not just talking about the Olympic ski jump. We're talking about labor. And as a side note, labor hurts. Whether it's early or later, it can still be very painful. And a lot of times these one and done contractions can be extremely painful. So don't fool yourself into thinking, oh, that's not painful at all. It can be quite painful. Now, I've been talking about the other signs that come with labor. I'm going to link those signs in a video up above and down below. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.